Hey folks, my name is Joe Biden, and today I want to talk to you in common sense terms about this health insurance debate and the whole question of health insurance reform. You know, sometimes in a debate filled with such passion, and I would add distortions, it's important to take a step back and get a little bit of perspective. You know, like many of you, I was just a high school kid when President John F. Kennedy started talking about Medicare. Talking about doing something so our seniors didn't have to find themselves struggling to get care long after a life of hard work and with no access to it. Over the course of my career, I built a record of protecting and defending Medicare. I think it's a sacred trust. I stood against the Medicare cuts in the 80s and 90s when others wanted to see Medicare wither on the vine. Remember that phrase? Well, you know, it's kind of an irony now that all those who are the successors of the people who opposed the creation of Medicare, who have tried for years to let it wither on the vine, are now saying to those of you that they are going to protect it, and that those of us who for years have fought against cutting Medicare are going to harm it. Now look, ask yourself, does that make any sense? The very people who have been fighting to preserve Medicare all these years, are we likely to be the ones to do it damage? And those who've been fighting to cut it and or not support it in the beginning, are they likely to be the ones who are going to protect it? Look, they're the heirs of those who would destroy Medicare. After all these years of defending Medicare, I'm not about to do anything to weaken it, to reduce your benefits, or to hurt the integrity of the Medicare Trust Fund. So folks, let's put this in perspective. You've earned those benefits, and we're going to make sure that they're there for you, unencumbered. Look, I know the arguments against government acting to protect your health care. I know what opponents have said. I've heard it before, and so have you. Well, you're hearing the same overheated rhetoric again. We're dealing with the same scare tactics and the same malarkey. Rationing, threats that seniors won't get care, seniors will die sooner. Come on. Enough of the scare tactics. It's time to set the record straight. Look at me. We're not raiding Medicare. We're not cutting guaranteed benefits. Health insurance reform is going to protect Medicare. Not a dollar from the Medicare Trust Fund will be used to pay for the plan. As AARP has said, health insurance reform, and I quote, will help strengthen Medicare's long-term financing without increasing costs for beneficiaries that make health care less affordable. I'll tell you what we are going to do. We're going to get rid of waste, fraud, extend the life of the trust fund in the process. If we don't act now, the Medicare Trust Fund will be in jeopardy by 2017. You know, they say the government bureaucrats and panels are going to make your health decisions. Simply not true. The exact opposite is true. We're actually going to give you more power to you, and more power to your doctor, because we're going to do this by making preventative care free. And finally, we're going to cut the costs that seniors get caught in having to come up with, the so-called donut hole, that gap between prescription coverage between $2,700 and $6,200. We're going to close that hole. You know, back in the 60s, it took a special group of concerned Americans. They were then called the National Council of Senior Citizens. They spoke out to show Americans that in no uncertain terms, that Medicare would improve the lives of seniors and improve it for generations to come. They cut through all the clutter and nonsense coming from those who opposed Medicare. The same people are now telling you they're going to protect it. They stood up and they fought for quality care for older Americans. So I'm asking you again, stand up. Stand up and fight for Medicare again. Fight for what's right, for you, for your children, for your grandchildren, and for the generation of Americans to come, to make sure they have the benefit that we've had, that our generation has had, the benefit that's come from Medicare. It works. We're going to keep it, and we're going to improve it.